The Gay Agenda, Political Conspiracies, Affirmative Treatment. Previously, Political Conspiracies, Efforts to Secure Gay Rights by Conspiring with Liberal Elites. December 15th, 1973. The American Psychiatric Association decided today that homosexuality is not a mental disorder. It was a political move.
Political stances seem to override any scientific results.
It's now considered unethical to treat homosexuality.
Bans on conversion therapy infringe upon numerous aspects of individual or group autonomy. Free choice must always be respected.
For those people who want help, banning that therapy would be an abuse of human rights.
In this episode, we move from conversion therapy, SOCE, sexual orientation change efforts, to gender-affirmative treatment. In June 2021, Singapore Psychological Society denounces conversion therapy, advocates affirmative treatment for LGBTQ clients. Current research indicates the inefficacy and possible harmful effects of conversion therapy. As such, we recommend exploring and affirming their orientation or identity. Is the SPS's position based on science or politics? Let's begin by looking at the history of gender-affirmative treatment.
Magnus Hirschfeld was one of the founding fathers of modern sexology and was one of the founding fathers of the modern gay and lesbian movement.
Hirschfeld's use of science in the cause of gay rights has, for many, made the science itself suspect. According to the Royal Society of Medicine in the UK, in 1910, Magnus Hirschfeld was the first to coin the term transvestitism. In 1932, the first documented gender reassignment surgery was performed, and Hirschfeld oversaw the surgery. This is Dr. Harry Benjamin. Dr. Harry Benjamin was a close friend of Hirschfeld, who also had a keen interest in transgender healthcare and advocacy. Benjamin's politics brought him into the circle of sexual radicals at that time, including Alfred Kinsey. How has Harry Benjamin's politics impacted transgender medicine? In 1966, Benjamin authored The Transsexual Phenomenon. Then, in 1973, he published Transsexualism together with Charles Ihlenfeld, a gay man. In 1979, Harry Benjamin International Gender Dysphoria Association was formed. It was renamed the World Professional Association for Transgender Health in 2007. The association issued the first version of the Standards of Care for Gender Identity Disorders in 1979. Charles Ihlenfeld and Harry Benjamin had worked together for 6 years, and in 1979, when Benjamin was 94 years old, Ihlenfeld was slated to become his successor. But a surprising twist happened. In an article by Ihlenfeld himself, Harry Benjamin and Psychiatrists, the author, Ihlenfeld, worked with Dr. Benjamin for 6 years, was to become his heir apparent, but then left the practice to undertake a psychiatric residency. In 1979, the same year that Harry Benjamin Association was formed, Garrett Oppenheim interviewed Dr. Charles Ihlenfeld. According to Oppenheim, after 6 years of treating some 500 cases of gender dysphoria, Ihlenfeld concluded, 80% of the patients who want to change their sex shouldn't do it. There is too much unhappiness. Too many of them end as suicides. Sex change is a kind of reprieve. It buys maybe 10 or 15 years of a happier life. This is Walt Heyer, a detransitioner and founder of sexchangeregret.com.
1979, Dr. Ihlenfeld came out to a group of psychologists in Tappan, New York. What I'm seeing now after 6 years is too much unhappiness and too many suicides of people who have undergone reassignment surgery. I'm going into psychiatry so I can help the poor people. So we knew in 1979 that reassignment surgeries and hormones was a total disaster.
Ihlenfeld is against giving hormones to persons under the age of 18. In fact, he prefers that they be at least 20 to 21 years old. In general, identity is still fluid in adolescence. Gender feelings still might change. Despite Eilenfeld's caution, the Harry Benjamin Standards of Care, now into its 7th version under the World Professional Association for Transgender Health, recommends physical intervention for adolescents. The use of GnRH analogues, hormone blockers, to suppress estrogen and testosterone production and delay the physical changes of puberty, hormone therapy to masculinize and feminize the body, and surgical procedures. What are your views on gender-affirming medical care for children by the standards of care? Are these standards driven by science or politics?
The American College of Pediatricians reports that 80 to 95% of prepubertal children with gender dysphoria experience resolution by late adolescence if not exposed to medical intervention and social affirmation. Dr. Levine, do you believe that minors are capable of making such a life-changing decision as changing one's sex?
Well, Senator, thank you for your interest in this question. Transgender medicine is a very complex and nuanced field with robust research and standards of care that have been developed. And if I am fortunate enough to be confirmed as the Assistant Secretary of Health, I will look forward to working with you.
What are your thoughts on Rachel Levine's answer?
Do you support the government intervening to override the parent's consent to give a child puberty blockers, cross-sex hormones, and/or amputation surgery of breasts and genitalia? Will you make a more firm decision on whether or not minors should be involved in these decisions?
Senator, transgender medicine is a very complex and nuanced field, and if confirmed to the position of Assistant Secretary of Health, I would certainly be pleased to come to your office and talk with you and your staff about the standards of care.
Let it go into the record that the witness refused to answer the question.
What are your views on Rand Paul's questions and conclusion?
Medicine is supposed to be based on evidence. We know that there are going to be harms down the line, but those harms aren't even known. I mean, we know there's going to be problems with bone density.
Hormone blockers? Doesn't anybody understand the most important part of becoming a human being is puberty? You're literally going from a child to an adult, and these things are so important for the growth of our brain, for the growth of our body, even for the growth of our genitals. It will actually make their penis not grow enough because they stunted the growth of their penis.
Up to now, the people who have been particularly advocating the need for children to have puberty blockers have been arguing on the basis not really of facts and evidence at all, but really a sort of ideology.
In August 2021, Hacking Unicorn posted on their Instagram, "Science rules, medical professionals, we should affirm LGBTQ+ people. LGBTQ+ activists, we should affirm LGBTQ+ people. Science rules, we should affirm LGBTQ+ people. Is this true? Do medical professionals agree?" Did you know that back in 1979, that same year, the Harry Benjamin Association was formed? Dr. Paul McHugh, the former chief of psychiatry at Johns Hopkins Hospital, shut down the hospital's program for gender affirmation surgeries. I'm not against transgender people, but such help should be psychiatric rather than surgical. Let's review what is considered to date the most thorough follow-up study of people who have had sex reassignment surgeries over a 30-year period between 1973 to 2003 in Sweden. The overall mortality for sex reassigned persons was 2.8 times higher during follow-up than controls of the same birth sex, particularly death from suicide 19.1 times.
There was a 19 times higher hazard of suicide, of completed suicide. This is in the context of Sweden, which was by far the most welcoming, accepting society of transsexualism, even through the 70s.
Sex reassigned persons also had an increased risk for suicide attempts, 4.9 times higher, and psychiatric inpatient care, 2.8 times higher. Conclusions: persons with transsexualism after sex reassignment have considerably higher risk for mortality, suicidal behavior, and psychiatric morbidity than the general population. August 2020, the American Journal of Psychiatry. Treatment for anxiety disorders was higher in persons diagnosed with gender incongruence and who had received gender-affirming surgery relative to persons diagnosed with gender incongruence and who had not received gender-affirming surgery.
Initially, I felt what a lot of people refer to as gender euphoria. Once you begin presenting as your desired sex, you get this feeling of euphoria where it's like everything is right in the world suddenly. I had that for a very, very short time. I want to say maybe a few weeks. I actually found that dysphoria increased dramatically in me. I started growing hair and my voice started changing very rapidly. So as those changes came on, I became exceptionally suicidal. My discomfort with my body was increased by 100. I would look in the mirror and I would just burst into tears. I couldn't see myself anymore. I couldn't hear my voice anymore. And it made it really difficult to continue. And I addressed this consistently with my gender therapist, and she persisted that this was normal.
How would you advise a loved one with gender dysphoria? Do you think gender-affirmative treatment should be the only choice available for gender dysphoric patients? Today, in some parts of the world, affirmative treatment has become the default standard of care for LGBTQ patients, including children.
If you take your child to a clinic to seek help, affirmative care means the therapist must follow the child's lead. The professionals must accept a child's gender identity. In fact, this is the law in many states. Under conversion therapy bans, questioning a child's gender identity is now illegal.
One of the key parts in all this is affirmative care, which may be the most sort of horrifying medical scandal of our time. Every medical accrediting organization told doctors to affirm the patient, to agree with the patient's self-diagnosis.
As a medical practitioner or as a psychotherapist, psychotherapists are now bound, as far as I've been able to determine by examining the law, to adopt precisely this gender-affirming position.
New York City threatened fines of up to $10,000. So a counselor who helped a man who feels like a woman but wants to live as a man could be fined $10,000. But a counselor who helped a man live as a woman, that's totally different, according to the city of New York.
I get someone referred to me by a plastic surgeon, and she wanted the plastic surgeon to operate on her nose. It seems odd to me that no one's saying we have to affirm straight away this person's abnormal nose and operate on it. And yet in clinics all over the world, someone presents and says, I want to get rid of my penis, or I want my vagina removed and replaced with a fake penis that can never be a penis. And we have to affirm it.
We have to ask ourselves whether we are dealing with poor scientific inquiry or, more seriously, fraudulent research actively designed to arrive at a presupposed ideological and political position.
People are detransitioning. Do you know what detransitioning is?
Yep.
That is a scary space. When a child who's literally said I'm trans and 4 years later goes, oh my God, I made the biggest mistake ever and I have hair on my face and I cut my boobs off and they're 20 years old and they had a hysterectomy. Now, how are we letting that happen?
Should advocates of gender-affirmative treatment address the issue of detransitioning or the possible harmful effects of gender transitioning? Singapore Psychological Society advocates affirmative treatment for LGBTQ clients. We recommend exploring and affirming their orientation or identity. Regardless.sg, a news and media site, commented, surveying SPS's sources, most suffered from researcher bias. Hacking Unicorn, Science rules, we should affirm LGBTQ plus people. Regardless.sg, Regardless believes in civil conversations, so we engaged on the science of it, but they restricted us. The restrict feature on Instagram allows Hacking Unicorn to hide or delete comments posted by regardless. Should alternative viewpoints that question the efficacy and concept of affirmative treatment be silenced? Why would Hacking Unicorn censor regardless.sg? After the ball, let's be blunt. Those who aren't with us in this effort because they think we're politically incorrect are most decidedly against us. Our primary objective is to cow and silence them as far as possible. In favor of gay rights, the intransigents will eventually be effectively silenced by both law and polite society. Do you support this silencing strategy of LGBT activists? How has this impacted society?
I would like for there to be a cure to gender dysphoria in my lifetime. No one ever talks about that. All I know is that this climate has created a very unsafe environment for those studies to proceed, if you've noticed. Researchers are so scared of not being PC that they're not even doing those studies anymore. And I think that's ultimately harmful.
In Britain, we have James Caspian, who was a psychotherapist who wanted to do research for his master's thesis on detransitioning because he'd seen it in his own practice. Bath Spa University didn't allow him to actually study this because if he found out the wrong things, it might harm the reputation of the university. So that's a very tangible example of how research gets stifled.
In Singapore, Dana Teo, a National University of Singapore student, wrote, "Now, even asking can be construed as offensive. I would probably just sit quietly, smile and nod if someone said children should have access to puberty blockers, no questions asked. If I were allowed to speak freely without risking being crucified, I would ask questions like, there are people who detransition. If you halt puberty in children, would that be really bad for them?" Censorships on social media.
For example, if I walk into my doctor's office today and say, "Hi, I'm Margaret Thatcher," my physician will say I am delusional and give me an antipsychotic. However, if instead I walked in and said, "I am a man," he would say, "Congratulations, you're transgender." If I were to say, "Doctor, I am suicidal. I'm an amputee trapped in a normal body. Please surgically remove my leg," I'll be diagnosed with body identity integrity disorder. But if I walk up to that same doctor and say, "I'm a man, sign me up for a double mastectomy," my physician will.
Ever heard of the Grievance studies hoax?
Some researchers were thrilled to get an email from a journal that said,
"I have now closely considered the revisions of your manuscript, dog park, and
they're laughing because they just pulled off a hoax.
And will recommend its publication in Gender, Place, and Culture."
They claim to have closely examined genitals of nearly 10,000 dogs to learn about rape culture and queer performativity.
This shouldn't have been possible. What appears beyond dispute is that making absurd and horrible ideas sufficiently politically fashionable can get them validated at the highest levels of academic grievance studies.
They have placed an agenda before the truth.
Have ideological political positions affected objectivity in medical science? What are your views on gender-affirmative treatment for LGBT persons? Follow us on